we are covering vital signs assessment, a topic guaranteed to appear on your NCLEX exam. The test will not just ask for normal ranges, but will require you to apply these numbers to clinical scenarios to make judgments. Let's start with blood pressure, a high-yield area for trick questions. The most common exam trap involves the cuff size. Remember that a cuff that is too small will produce a falsely high reading, while a cuff that is too large will give a falsely low reading. The exam might present a scenario with an obese patient and a normal-sized cuff, asking you to identify the reason for an unexpectedly high reading. Another key concept is orthostatic hypotension. The NCLEX expects you to know the exact procedure, which involves measuring the blood pressure and pulse with the patient lying down, then sitting and finally standing, waiting 1 to 3 minutes between each position change. A significant drop in systolic pressure of 20 points or diastolic pressure of 10 points upon standing is a classic sign and a major fall risk. Next, let's discuss pulse. The test will expect you to know when an apical pulse is necessary. For any patient on cardiac glycosides like digoxin, or for any patient with an irregular rhythm, you must take an apical pulse for a full 60 seconds. Simply palpating a radial pulse is incorrect in these situations. For respirations, the key is to assess without the patient's awareness, as their breathing pattern can change if they know they are being watched. A classic NCLEX scenario involves a patient receiving opioids. If you are given a patient on morphine with a respiratory rate of 8 breaths per minute, the correct action is not to simply document it. It is an emergency requiring immediate intervention. When assessing temperature, understand the contraindications. A rectal temperature, while most accurate, is contraindicated in newborns, patients with bleeding disorders, or after rectal surgery. For oxygen saturation, the NCLEX will test your understanding of its limitations. A pulse oximeter reading of 98% can be dangerously misleading in a patient with carbon monoxide poisoning. The device cannot differentiate between oxygen and carbon monoxide bound to hemoglobin, giving a false assurance of adequate oxygenation. To help you remember common causes of tachycardia, use the mnemonic fever. This stands for fever, exercise, volume loss as in hypovolemia, epinephrine and other stimulants, and respiratory distress. Finally, the NCLEX prioritizes trending over single readings. A single blood pressure of 150/90 might be less concerning than a patient whose pressure has systematically climbed from 120/80 to 140/88 over the past 3 hours. This trend indicates a worsening condition, like developing preeclampsia or a hypertensive crisis, and the exam will test your ability to recognize this pattern and act. Your priority is always to interpret the story the vitals are telling over time, not just the single snapshot.